So let's take a look at when you're evaluating a shoulder. So we all know that there's a certain rhythm to the shoulder, right? So as the arm, as the humerus comes up, you'll see the scapular move. So it's real important to take a look. And this you can do on anyone. I really honestly encourage you to assess just about everyone you know. If I'm just looking for normal motion, I like to do both arms at a time, right? So thumbs up, elbow straight, and what you want to be able to see is how smooth their motion is, right? How smooth their motion is. If they click, like my shoulder just clicked right there, right? You're looking for elbows stay straight, arms next to their ear, and don't buy into when people tell you, I'm not really flexible. They're gonna go to wherever they're gonna go, but their arms wing out a lot. They're tight somewhere, right? They just are. They're tight somewhere. You just have to figure out where they're tight. Now, obviously, people who work out and they're bulkier, you're gonna see them a little different. They're not gonna be able to go all the way straight just because of how bulky their muscles are. So you have to take that into consideration. But for the most part, people can move their arms, and they should be able to get their arm next to their ear, right? Anytime you look at someone's arm, you're gonna see little nuances, right? So if they bring their arm up and one arm wings out a little bit, they're tight somewhere, right? If they click, they pop, they hurt, that's what they're there for, but that's essentially what you're looking for. The other thing is when we're looking and we're assessing scapular motion, you've got to look at how someone's ribs move, right? Remember, the scapula sits on the 2nd and 7th ribs, and your ribs go from front all the way to back. So if someone moves up, right, and they arch their back like that, you know that they might be stuck somewhere here, and you have to actually get them to pull their ribs down to get better movement. When you're first doing it, you might not get too specific. You might just say, I just want to see how you move. Bring your arms up, bring your arms out, bring your arms back, put your hands behind your back, put your hands up like this behind your head. See if you can move your elbows up. I do a very general one if I'm just looking at general. Let me see. If I look at general motion, where do I then now want to focus my attention? So I might just look at general motion just to see, because that's where you might see like some nuances. Someone goes like this and they can't pull their elbow back. They're gonna go internal rotation, and you're looking for, when they go internal rotation, you're looking for elbows to come forward. So elbows come forward and shoulder goes back. If they can't bring their elbows forward and their shoulders back, they're tight. Capsular tightness potentially, but it all plays, and scapula is always, for the most part, involved. Because they can't go internal rotation, you're gonna see them tip out. This inferior, you're gonna see it tip out because it's stuck, right? So these are little nuanced, little things that you're looking for, one side compared to the other side. So first you wanna look at normal motion, and then you're looking for abnormal motion. If you tip out, so here's the tip, inferior angle, tips out like this, or if you have winging. If you have winging, then the medial border comes off more, and the shoulder blade rotates. It's called internal rotation. I only need to know that for the test, but internal rotation.